Good evening, everyone, and welcome to our Facebook Live session. Now, this session is for Smethwick Medical Centre and Black Country Family Practice patients to tell them all about Rapid Health, our new patient access system. My name's Lois Brown. I work for Modality Partnership, and I'm here with Maxine Rowley, who's the Divisional Manager for Birmingham, and Dr. Nazreen Ahmed, who's one of our partners in Birmingham. So this evening, don't worry if you can't watch everything right now. This is recorded and will be on our Facebook and YouTube Live going forward. And we do have the opportunity to ask questions in the chat, and we'll try and answer as many of those this evening as possible. But to start off with, Dr. Naz Ahmed is going to do a short presentation to tell you all about the new system, a bit of a demonstration, and then we'll be able to get back to answering some questions for you. So I'll hand over to Naz to do the presentation.
Thank you, Lois. So as I said, my name's Dr. Nazreen Ahmed. I'm one of the GP partners who works in Modality Birmingham. Some of you may have seen me, some of you may have not, because I work in a slightly different part of Birmingham. However, I'd like to take this opportunity this evening to introduce to you our new access system and talk you through why we've introduced this and how it works. Just some brief housekeeping, just to advise you that this is a virtual meeting. So if you have any fire alarms or you need a comfort break, please do respond to those. And as Lois had mentioned, we are recording this. So if you miss any of it or you haven't been able to join at the start, you will be able to watch it back later, and hopefully we'll be able to cover some of the information within our presentation that answers your questions, but we will be taking questions at the end as well. So the aim of tonight is to introduce our new online booking system, which goes live on the 12th of November. So I'd like to hand over to Maxine to talk you through what we've been doing and why.
Hi, good evening, everybody. So I'm going to start sharing kind of the reason why we're moving across to a new system and a new process. We've listened to patient feedback, which we've been collating monthly, and we do get feedback such as displayed on the slide. You know, people don't have a choice, waiting in a queue on the phone system. You can't get an appointment when you need to be seen. We also take into consideration the annual National Patient Survey and look at our online reviews. So this is just a snap of what the feedback that you give us. I think what's really important is that actually we want to make sure that this works both for you and also our staff. You know, lots of you do give our staff lots of positive feedback, and it's really, really important. But they are also seen as a barrier to you getting the appointment when you need it as well. We want to ensure that the care that you receive, is that you feel good and it's excellent, and that you do understand why you've seen a certain clinician and where you and when you've had your appointment. I think the biggest challenge we have at the moment is that in the queue system, you're waiting for over 2 hours. We do have data that shows otherwise as well, but on our peak times at 8 o'clock in the morning, there most definitely is that problem. And so we want to help you to access our system in a much better way. Next slide, please. So this is giving you a snapshot of just for the month of August, and this is from our phone system of the number of calls we've had for Black Country and Smethwick, who combined we have approximately 25,000 patients, and as you can see in August we received over 16,000 calls that month. That's not unique, and it's also not sustainable. So next slide, please. So phones are our main problem at the moment, and this has a big impact not only on yourself getting an appointment, but also on our staff, because they desperately want to help you to get the appointment of your choice. Our staff are really proud to belong to the NHS, and they come to work every day because they want to help people. And we want to help you get the right appointment. But under the huge pressures we've shown, they do face a lot of abuse, and it isn't their fault. And we want to help resolve this situation. And that bit's really important. Part of our contract with the NHS is what we need to do is to provide online access. And some of you have been using it via the NHS app and online booking, but it's limited and it's a bit sporadic. We want to make sure that we have a fairer solution for you. So, Dr. Ahmed, back to you.
Okay. Thanks, Maxine. So I think, as Maxine said, you know, we've had a huge amount of phone demand, and not just so answering the phones is just one aspect of the job that our reception team do to try and help look after patients. They're looking after prescriptions, they're looking after documents that are coming in from the hospital. There's a huge amount of work that's going on behind the scenes that doesn't always get reflected in the experience our patients have in trying to book an appointment. So there's lots of factors going on here that have led to that feedback that we shared right at the beginning of patients feeling dissatisfied, frustrated with the system. That 8 a.m. rush where you have to ring at 8 o'clock in the morning and try to get an appointment, and sometimes you'll be waiting for 2 hours and not getting not even getting an appointment at the end of it. And as you saw from our telephone data, we've got rising levels of patients wanting to be seen. And as you know, with the NHS, that we have a limited capacity. We're getting requests from patients to be booking online, but we also want to be able to provide patients choice that is safe and it is the right access with the right person at the right time. So that 8 a.m. rush is causing a lot of stress to both patients and to our staff. We want to be able to book people with the clinicians that you wanted to see or needed to see, depending on the problem that you were coming to see us with. There are lots of challenges there, but we wanted to find a solution that helped us bridge some of those gaps. So what did we do? So we formed a team of GPs and managers to understand what options were available and to find the right solution that worked for both you as our patients and for our staff as well. And we looked at lots of different systems that are available, visited some practices both locally and around the country to see what they were using and to see, would it work for our patients? Would it work for this, for where we live and who we serve? So we had some meetings, we looked at the options that were available, and our aim was really quite simple. It was to simplify our appointment system to give patients a better choice. So the system that we went with is called Rapid Health. We looked at a number of different ones that are available. There are several reasons why we chose Rapid Health. First of all, it is NHS approved, which is really important that we are working with something that is safe and has had all the governance paperwork and legislation done so that we can use it. It meets all the safety requirements from that perspective as well. It is also web-based, so it is not an app. You don't have to download anything. You don't need a login to use it. All you need is your name, your date of birth, your postcode, as well as a telephone number that we can contact you on, and a valid email address attached to your online your record with your GP. You can access it directly through the web and through our website, through a web link, and it is available 24 hours a day. Where it's appropriate, it will also offer you an appointment for a clinician at a time that suits you, and a variety of those appointments depending on what the problem is. If an appropriate appointment is not available, it will keep the data that you have submitted and send that to the inbox for a doctor to be reviewing that day. So it just gives everybody an opportunity to ask the question, to tell us the symptoms that they're concerned about, and we can provide the help that's appropriate for that problem. So Some of you might remember eConsult, which were really good form of online consultation. You could contact us again at any time of the day, give us all the important information so we could help you as best as possible. The difficulty with eConsult is that it needed a doctor to read all that information to then make a decision as to what appointment that person needed and where to book them. Some days we would get up to 200, which actually required a lot of work at the practice from both a doctor and reception team to manage that workload that was coming in, and actually took doctors out of being able to provide appointments. So it wasn't the perfect solution for this. We looked at some other systems that do also do a little bit more than just submitting a form that a doctor then reads, but they still needed a practice to book the appointment at the end. So one of the reasons why we chose Rapid Health was because it does the whole journey with the patient. So from identifying you as one of our patients, sort of formulating an assessment with you, asking questions about the symptoms that you are concerned about, working out what the urgency and the priority is, and then navigating you to an appointment to be able to book and confirm all in one go. So from deciding that you need an appointment to be booking an appointment, it's all in one process. So for any system to work, it needs to be easy, fast, safe and standardized, and that is exactly what Rapid Health is. From the point of time where the patient identifies themselves on our system, the system is able to assess and prioritize what your medical problem is, and then it navigates the system that we have to look at a choice of appropriate appointments, whether that could be face-to-face or telephone, and it includes whether that needs to be urgent today, by tomorrow, in a few days. And I think that really does help that sense that actually for a problem that you might need a solution for, you need to speak to a doctor, but actually doesn't need to be dealt with today. You've got other priorities happening. You've got work, you've got children, you've got family, you've got other things that are going on today, but something that still needs a consultation, you can book that at a time that is convenient for you, as appropriate on the appointment availability. So it's all well and good me saying this is brilliant, but what do other patients think about this system? So this system has been going live for 5 years around the country at different practices, and we looked at their patient satisfaction feedback to make sure that this is something that patients really appreciate using. And the feedback from other practices has been really positive. Patients like having a choice. We know this. That is part of the feedback that we have had from you. And they like having the choice available to them when they were booking the appointments. They found the questions that were being asked of them very simple and easy to navigate. And they found the system on the whole quite easy to use. 86% is a fantastic achievement. And nearly 70% of patients chose this system to be able to book their appointments. Okay, so what I would like to do is show you what it looks like so that you can see why we've chosen this system and how we know it will be helpful for us to help you book appointments. So what do? You go to our website. So if you Google Smethwick Medical Centre, Black Country Family Practice, and you go to the website, so this is what it looks like for Handsworth Wood, and all our Modality Birmingham websites look the same for that reason. And you click on appointments information, and you can submit a new request using our online tool. So there's lots of different places you can click on that will take you to this next slide that I'm showing you here, which is the welcome page for the medical request. So from this web page, you can complete a medical request and book an appointment if it's appropriate. You can also send us admin requests, so things like changing your details, requesting fit notes, requesting a letter from a doctor, or asking a doctor a question that doesn't need an appointment. We've got that facility there. You've also got the ability to get some information to help yourself at home for a wide range of conditions and symptoms that might help you in the meantime. So what I'd like to do, if possible, is to show you a quick video of what it looks like from a patient's end of how the process works. Lois, could I ask you to play a video? Thank you. And I'll talk you through it. So this is what the, as I said, this is the warm welcome page. It goes through making sure that you haven't got any worrying symptoms at the beginning, which we would always do that in anyway. When you say you have none of those, it goes to you click on needing medical advice, and you can free text what your main worry is. So that could be back pain, it could be side pain, and it tries to find which would be the right set of questions to ask you. And you can click on it and say, oh yeah, no, that's suitable for the type of back pain that I'm thinking of. Click select. Then you need to put in your details that are registered with your practice. So your date of birth, your sex at birth, your first name and your last name, exactly how it is registered with us. You also need to put in your postcode. Now, for this system to work, you do need to have a valid email address on your medical record with your practice. So if you haven't already got one on your notes, please contact your practice and we can add that in within a few seconds, and then you're able to use the service. So this is a test patient, hence the unusual name, and no patient data will be shared, just to reassure you. So you put in your details, postcode, email address. That's our generic email address for one of our practices. And we need a telephone number to contact you on. It doesn't have to be the one that's registered with you, but a number that the doctor, if they need to ring you, they've got that number there that you are able to be reached on. Okay, so you complete all those numbers, click next. Takes a couple of minutes to link with our system. Again, it's just those safety to make sure that you understand what we're doing and why. It's allowing you to book an appointment or for us to contact you on the information. You go through the symptoms, clicking whichever ones are relevant to you or most important. And you might have all of those, you might have only one of those. And some of these questions might seem a bit unusual or a bit lengthy, but actually they're the questions that I, as a GP, would be asking you to understand a bit more about your problem so I can help you best. So those questions and answers are really important in understanding how urgently you need to be seen and who needs to see you. Could this be one of our physios? Could this be a GP? Could it be one of our clinical pharmacists? So that's really important that those questions are answered as fairly as you can. Again, these questions are ones that I would be asking you. Well, how did it start? Was it sudden? Was it gradual? All of these questions have been vetted by a clinician and a clinical team so that they are important and relevant to your condition to make sure that we treat you safely. Okay, so as you can see, a lot of the questions are ticky boxy or drop down to try and avoid you having to think about typing all the words and the spelling and things like that. We want to make this as easy as possible. And sometimes there's always an option of I'm not sure. So yeah, we go through those questions. Most of the patient journeys, as we call them, can take about between 3 to 5 minutes. So it's really important and actually really helpful in the long term, because all these answers will be saved to your record. And when that clinician is consulting with you, they're able to see those answers and tailor their next set of questions or their examination findings to be able to help you best. Okay, so go through the questions. You may find that you are, doing this on behalf of a patient or behalf of a family member, which is absolutely okay, so long as you put their details in at the beginning and not yours. If you're helping somebody, you can answer these questions on their behalf, which is really helpful, actually. Okay, so again, whilst it identifies you as our patient, it doesn't look at your medical notes. So if you do have significant medical histories, that's why it's asking you those questions, so it can put the answers that you've given us into context. And again, it asks you those concerning symptoms just to make sure that this is not something that needs to be seen today. And again, once you've submitted it, it links to our system again to look for all the appropriate available appointments for that condition that you have submitted for. Takes a little while because there can be several appointments that they're looking across several days. Now, this is just an example. I promise you our appointments are more than 1 minute long, but this shows you that actually the appointment is available on the Friday the 13th. You click on the appointment. This is a telephone call, as it says in the confirmation. You can click on confirm, and that books you that telephone consultation. It will then send an email back to that email address that you provided at the beginning, confirming your appointment. If you need to contact us, it will have our telephone number and our generic email addresses, and a link in that email if you need to amend the appointment. So I hope that helped explain the system. Yeah, and I'm sure there'll be many questions that we'll take at the end. Okay, so can I hand over to Maxine now?
Hi, well, so we hope that that brief demonstration helps you to show you how easy it is to use, from clicking on the website to booking the appointment, following through those questions. There are a few areas that are staying the same, and this is because Rapid Health is not licensed for some areas and one in particular is for under 16s. So Rapid Health cannot be for under 16s. You will still need to ring the surgery, and our reception team are trained to take the information from you, and also the same for home visits, because that's important, and we need to make sure that you get the right appointment and the right time, and we arrange the visit that's mutually agreeable, because sometimes you may need to have a family member with you as well. We will still be contacting you to book our annual reviews. Most of you might be used to getting a text message where has a link in it, and we ask you to click on it and book that appointment. And if you can't do that, you can just ring the surgery and we can help you book that appointment. So there are a few things that don't change at all. The planned annual reviews include your long-term conditions, diabetes, asthma, COPD, NHS health checks. And the other thing we're staying the same is postnatal reviews and baby checks. We will contact you so that we can work with you to arrange these appointments. Next slide, please. So one of the most common questions that we get asked is for patients that aren't online, and I've noticed a few of those questions coming in the chat. So, what if I don't have access to a computer or a smartphone? What if I'm not computer literate? We recognise that not everyone will be able to use the online booking process that we put in place, but what it means is for those that can and will access this, it will take them straight through to the appointment. It will free up an awful lot of phone calls, and what it'll do is enable our staff taking calls to actually take that information over the phone from you, so that they can help you to book the appointment. We have a process in place, so if somebody does it that way and doesn't have an email address, we can do that, and you can still get the appointment of your choice booked as well. So that's relevant to any of the information that you've shared. We would like to encourage everyone that can use the online service to do it that way, because you will be surprised at how many appointments are available for you over 1 to 5 days. Obviously, if the system has deemed that it's medically necessary for you to be seen on the day, that will go into your smart inbox. And what that will do is that you've got to look at what you have submitted, and a member of our staff, all the doctors themselves, will pick up the phone and speak to you as well. What it's going to do overall is ensure that actually our receptionist is less seen as a barrier to appointments, and give everyone fair access to having an appointment with a clinician that is appropriate for them. The other thing to bear in mind is also that oh, sorry, next slide as well, sorry, is that you can still use the NHS app. You've still got access to your patient records through your AirMid. If you've already got your online access, that's fine, and that's for viewing your health records and results. You can also use the prescription line, Voice Connect, to order your prescription by phone. That stays the same. The only thing that's going to be different will be booking your appointments, which can be done via the web link or by phoning our surgery, where our staff will be more than happy to help you. Dr. Ahmed, back to you.
So I hope that was really helpful. Thank you, Maxine. And thank you, everybody, for your time this evening and your engagement. I suppose now would be a really good time to answer some of the questions. We've got a very busy chat.
Yeah. Thanks, Naz. So yeah, we've got some fantastic questions. Thank you so much, everyone who's contributed and being so patient to wait for us to come and answer them. So I've started a lot of questions, and I will go back to the live chat to check there's not any more in a minute or so. But we've got a good 30 or more to go at. So
okay.
So there's a few questions about it's not on the website yet. It's not live. It's not live yet. When does it go live, Naz?
12th of November. So 12th of November, the link will be available. Sorry,
can I just come in at that point? So the actual online form is going to be available from 4:30 on the 11th of November. So it will be available on the website, and this is the new website for Black Country and Smethwick that have been live for most of this year, but it will be available on there from 4:30.
I'll post the new websites in the chat in a minute. That's excellent. And also some questions about how long will it be open. Will it avoid the 8 a.m. rush? So actually it's open. How long is it open, Maxine?
24/7.
24 hours a day, 7 days a week. So no rush to go and get on there. They're available all the time, always open. So that was a few initial one.
Yeah. See, I was just going to say that the reason that we've kept it open 24 hours a day is that we realise that patients, your medical problem doesn't always allow you to ring at 8 a.m. There are other things going on, but it doesn't mean that your concern is less valid than somebody else who was able to ring at 8 a.m. We wanted to give fairer access to everybody to be able to answer the right question at the right time. We understand your frustrations, that you are worried, unwell, and if you don't ring at the right time, you don't necessarily get an appointment. And I think what we're trying to do is work smartly with what we've got, and that might mean that that medical problem that you asked us a question about didn't necessarily need an appointment with a doctor. It might have needed a different type of clinician. It might have needed a different service. And what we're trying to do is make sure that we give the right care to the right person at the right time, and that means that we can also allow you to ask those questions at any time that helps you do that, if that makes sense.
That makes perfect sense. So there's a question about availability of appointments outside of normal working hours for those people who work long working hours. Now, I'm not from the Birmingham area, but Maxine and Naz will be able to answer. Maxine, what are your enhanced access hours and appointments that are available to Smethwick and Black Country?
So the extended hours for Black Country and Smethwick are run out of Portway. And we do appreciate that we get a lot of feedback that people say that's too far, but that is collectively for the PCN where the extended hours appointments are.
The PCN, like the group of practices that they're in, is that's where they choose to offer those extra appointments.
Yeah, and that includes Saturdays as well.
That's great. So someone's asked a question about, will it have a limited capacity? Will it be like it gets to whatever number and then no more appointments, that's it? Naz?
No. So there isn't a cap that we have put on the capacity of questions that people can ask and the number of submissions and appointment requests. As you can understand, there may not be an appointment available for every single condition, but those patient requests will still come into the inbox for a response, which may well be information relating to local services. So we have a minor eye condition service, we have a pharmacy first condition service, we've got lots of other teams that we work with who might be able to help you with your concern. So that was the aim of to be able to answer all the questions that you guys ask us in a timely manner.
There's a link to that. There's a question about, so obviously about capacity, and obviously in doing this, we are massively expanding our capacity to offer patients appointments. But someone was saying, when you were struggling before, why did you continue to carry on taking on more patients? And I was going to give an answer about the commissioner. Make sure that you actually do that. But Maxine, you might want to answer that.
So is that more about, sorry Lois, is it more
keeping
about
our patient list open if you were struggling
previously? So yes, okay, so we have to keep, it's a contract requirement that we keep our lists open. We do have a very mobile patient demographic across general practice, and so actually it might seem like we're always taking on new patients, but as many move and change, locate, relocate, so it's not increasing exponentially or anything like that. And if we were to close, we have to close for a minimum of 1 year.
Thank you. So, well, with the new system, I hope we've got lots more capacity, so hoping that's not going to be an issue going forward. So good question here about online access of being able to book appointments like through System Online and NHS app. Why did you take that away, Naz?
Yeah, so we wanted a smarter solution. The difficulty with System 1 and AccuRx and the NHS app is that it felt very much like if you knew about it and you could use it, you can book an appointment, but it didn't give anybody any extra information about why the appointment was being booked, and could somebody else have been helping who might have been more suitable for that. So I had quite a frustrating consultation with somebody who'd booked their appointment with me. They had an eye condition. They actually needed the eye hospital. Had I had that information beforehand, I could have easily directed them to the primary eye care service or even to the emergency hospital, depending on how urgent their symptoms were, rather than them wasting their time all the way coming into an appointment face to face for me to say, unfortunately, this is the wrong person for this problem. So it's trying to be smarter with the capacity that we do have. And this is a function of this service that we can actually prioritize who needs to be seen, who could have it as a telephone consultation. Is this appropriate for one of our other health professionals to be able to manage? It's really trying to work with the current general practice that we have, where there are limited GP appointments, there are limited appointments with certain clinicians, and we need to try and be fair to everybody, so everybody gets a good experience.
Right, so there's a question about older people, people with learning difficulties, people with not English isn't their first language. What sort of things do we have in place now to accommodate that?
Oh, absolutely, it's really, really important. Now, as Maxine alluded to, that this isn't going to be for everybody, and we really would like to encourage those who can to use this service. It really does free up our reception team to be able to then spend time with those who have additional needs, who might need their support to be able to book an appointment. So our reception team are there still. They are answering the calls. They are helping patients use the service. So, for example, if somebody does not have access to the internet or they do not have an email address, we do have a process where we use our generic email address for the practice so that we can still go through the questions with that person and make sure they get the appointment with the right person at the right time and they are not disadvantaged. There are certain cohorts of people who this won't be appropriate for, such as those with learning difficulties, somebody who needs a British Sign Language interpreter, and we will accommodate that. But if you can use this system, then it really does make it fairer for those people to be able to access us, and we can answer their telephone call, not within the 2 hours that they've been waiting, but quicker, because we know that you guys are helping by booking your appointments using this system.
And like we talked about before, someone has asked a question about being able to input it for someone else, like a relative.
Yeah.
And so you can, and also there is an option at the top when you get to identify verify yourself, your name and date of birth. You can click filling it out for someone else, can't you?
Yes. I think so. So definitely you can, if you're filling it in on behalf of a relative, so long as they're over 16, then the person's details that you have put in at the top will come into their record, and we can deal with that. We have asked people if they do need an interpreter, please, if you're able to continue using the form, please do, and then contact us at the practice, and we will arrange that interpreter slot so that we can make sure that we deal with your problem with a language interpreter on the phone as well.
That's great. And also, can we reassure about under 16s and that process and young children? How's that going to work?
Absolutely. So we are still here to see the 16 and under patients. So our reception team are still here. Please call the practice. The reception team will ask some basic questions so that duty GP is able to facilitate and triage an appropriate appointment for that time. Winter is coming. We know that everybody is going to be becoming a little bit more unwell potentially with coughs and colds and all sorts that happen in the winter months. And we need to be able to be a bit dynamic with how we see you, assess you, make sure that you're okay. So our reception team are geared up to ask a few very simple questions to make sure that we see the really unwell people as quickly as possible. So please bear that in mind. But we are here. Please call, please attend your practice, and we will help you book an appointment or get the help that you need.
So the current system before we change is we've been trying to cram everybody into the same day every day like this, which doesn't work. So someone's asked a question about non-urgent routine appointments and reviews. How will they be affected by the new system? That's
a great question. So at the moment, our current system, as we said, was you ring at 8, you get seen that day. If there's no appointments available, walk-in centre, 111, try again. That's not sustainable. That's frustrating. And as we have seen, not every problem needs to be dealt with today. We don't have the capacity, and you don't have the capacity in your busy lives to be able to say, right, I'm going to drop everything and come and see you in 20 minutes. For non-urgent issues, when you answer those questions through the patient journey, it triages to work out, does this need to be seen today, tomorrow? Could it be seen in a few days because the symptoms aren't worrying, but they are symptoms? And it will offer you a range of appointments from tomorrow up to 5 days. That allows you to book that non-urgent appointment that suits your diary and your concerns. So yes, this allows us to do that in a safer, better, more systemic way, if that helps.
Yeah, that's good. So there's a couple of questions we can put together about what will the offering be? Will it be face-to-face? Will it be telephone? Will people be able to pick on the system? And how can they be reassured that actually they will get an appointment through the system?
Really good question. So coming back to the first bit, so depending on the problem, it might be a face-to-face appointment, it might be a telephone call that is offered to you, it might be both. Now, as a GP, I want to see you. If I need to examine you, especially, I need to see you. There are certain things that I can really only pick up and diagnose and manage when I see you. For example, abdominal pain, or you're worried about a cough and whether you might have an infection on your lungs, I need to have a listen to your chest to be able to make sure that that is the right course of action. And so there will be some patient journey that only result in a face-to-face appointment. I really want to see you so I can make sure that you're okay and that we get the right treatment for you. And there will be other things that actually that is suitable for a telephone consultation, and you'll have a choice to book that. With regards to if an appointment isn't offered, so that's a really important question, because there will be some things that you have answered that you might maybe have not been able to find the right pathway for you, and there is a general history one where you can give us a bit more information about your particular concern, and that will come into something called an inbox, where we have a doctor on duty every day looking at that inbox all the time to make sure actually that query has come in. I'm looking at the patient's words, what they have told me. I'm looking at their records to say actually what is the context of this. That person needs a telephone consultation, and the duty GP will either ring you or send you a link back to be able to book the right appointment at the right time using that link rather than having to go through the questions again. So that might be, simply you wanting your blood results. Well, okay, that's something that doesn't need to be spoken to me about today, but we do need to speak to you before the end of the week. So I'm going to send that person a link to book a telephone call before the end of the week. And then you get that link, click on it, book an appointment, and we ring you.
That's great. And there's a linked question here. So someone's saying if you go through and you need an urgent appointment that day with the GP and the no appointments are not available, what would that do? But that actually would land with the GP for review.
Still comes into the inbox. It comes into the inbox with a big red flag on it saying this is something urgent. So we have done a lot of training with our staff, both the GPs, our other clinicians, and our reception team, so that we are all working off this inbox to make sure that we are managing and monitoring your concerns and the urgent symptoms that come up at 12 o'clock, at 3 o'clock, and be able to address it and manage it appropriately within our working hours.
And is it worth also about when you get to that booking screen, you can actually filter and see who is providing those appointments, which doctors, and also you don't have any branch surgeries, do you, in any of the locations?
No.
Yes, we do. Yes, we do. At Smethwick we have Hollybush.
Oh, sorry.
So that would be the location option, wouldn't it, Maxine?
Yeah, but only for people that regularly go to Hollybush. So we filter with that. That's filtered within our clinical system.
Yeah, cool, excellent, thank you. So that's lots of good questions. So a few questions about if we all try and go on at 8 o'clock in the morning, will it crash? Well, it's going to be open 24/7 the night before, and we have also launched this in East Surrey in July, other Birmingham practices since the beginning of October. It's working in big practices. The practice I've been working with the past couple of days has 30,000 patients, and they have so answer to that question, no, it's resilient. But there is a good question: what happens when it goes down?
Okay, so we're still here. So absolutely, really important question. We have a business continuity plan. Every site has a business continuity plan because things happen, electrical issues, room flood. We've had and experienced throughout the years different things that have stopped usual practice, and we always have a backup plan. At the end of the day, we have pen and paper. So we are still here. If the internet crashes, if something happens, we are still here and we have a backup plan. But touch wood, so far, it hasn't crashed.
Okay, good. So the question here is sort of not quite related, but I'm going to answer it. I think we should answer it because it's there. Do doctors work a full 8-hour day, Naz?
So I don't want to tell you how many hours I've worked so far. General practice has changed a lot. And I'm not going to get my soapbox about this. The nature of general practice has changed hugely in the 11 years that I have been a GP. Do we work full 8 hours? Actually, we work 10 if you're working 2 sessions. So our GPs do work flexibly in the sense that some of us are less than full time, some of us are working more hours than 8. We are working hard to make sure that we provide care as per our contract with the NHS, as per the reason why we signed up to doing this job in the first place.
Excellent answer, thank you. So there's another bit of a question off is when will doctors start reading letters from hospital consultants and do things requested of them? So we do have a process, Maxine, about how doctor letters are read from the hospital. Do you want to explain?
Yeah, we do have a process. So most letters from outpatients appointments come through to us digitally. They can be that they are sent way after a patient receives a letter at home about their consultation. So it's, sometimes we are appreciative when a patient does come in with their letter and hands it to us. We then put it through our system, we code it, it's seen by a clinician, it's allocated out every day. depend on the number of clinicians we've got in, and they review them, they code them, they action it. Some could be a communication to a patient, some could be an appointment. We send you links and ask you to book it, but be reassured they all come through digitally to us, or the occasional one comes via email, and we then have to take it off our email system and scan it into our clinical system, and it goes through the same process.
Brilliant, thanks Maxine. So
Can I?
So
I'm just going to chip in from a clinical perspective, just in case it helps that person understand the context. Sometimes hospital letters may say things that are not actually possible to do by the general practitioner. So the GP is asked to do X. We can't actually do that. So we sometimes have to go back to the consultant and say that we can't do this certain blood test, or we can't prescribe this medication. Please could you either prescribe it or suggest an alternative? So that might potentially answer some of the concern. I think I can hear about a delay, about what a consultant has said and what then happens. But please, if that person has any concerns, please could you contact your practice so that we can pick that up?
That's great, thank you. So someone's asked about demonstration and surgery. So how are you going to handle it if someone just needs a bit of support just to get going on the system? Maxine?
Yeah, so we are going to have iPads available. So we will have champions to support in waiting rooms and with queues. Initially over the first couple of weeks, and then all of our staff are trained. They are aware what they need to do. They're aware how to support. They have guidance for patients. You will also have frequently asked questions on the website. So if you get stuck, can I just reiterate that it's not an app, it's a cloud-based service. So you will see if you still want to look at your health records, that's still through the NHS app or your AirMed online login. This is not an app. This is to help you book an appointment, to help you improve your accessibility to that service.
So as well, linked to that, Maxine, is can we still not go to the practice to make an appointment? So I think you want to say what you try and encourage people to try and get themselves if you can.
Really want to emphasise that for many people, we use online access all the time. And where we can, we would really encourage those people to use the online service. Try it, see how it goes. You might not get it right in your first time. We might not get it right the first time, but we are rapidly amending and changing and updating training for staff and listening to patients to ensure that you can access an appointment. And also data has shown that actually the majority of people don't necessarily want to be seen on the day. You know, we have the same problems with our staff when they're feeling poorly. They don't feel well enough they don't feel unwell enough to want to stay at home, but they know they've got to be around because they know their GP is going to call them the same day. This allows you to actually book an appointment if the questions you've answered says you might need one in 2 or 3 days time, and then you've got the choice there at your fingertips to be able to book it. And you can also cancel it and change it as well. So I need to reiterate that. That's really important, because obviously some of the blockers in our appointments being available is that actually across the NHS in primary care we have an awful lot of did not attend, and that's even when they've spoken to a clinician in the morning, booked an appointment in the afternoon, and they don't turn up. And so this way it's going to allow a much better way 24/7 to communicate with us around those appointments and any admin requests. You don't have to wait till 8 o'clock in the morning. If you think it's like you go to bed, click on the web link and put your question in there to us.
Yep, absolutely. So there's a couple of questions about email addresses again. So one, if you've got children and they don't have an email address, or if you've got people who just don't have one at all, how are we going to handle that?
So under 16s, as we said before, we're not able to use this system with under 16s just yet. It hasn't been licensed for that. So it's really important from a safety and governance perspective that we use the system that it's licensed to do. So for the under 16s and children, please call the surgery or attend the practice. The reception team will ask you some simple questions so that duty GP can work out if that's something that needs to be seen today, is a telephone consultation, and get you the appropriate appointment for that day or that problem. For those who do not have any email address, but still want to be able to use the service to book the appointment, we are using our generic email address on your behalf, and our reception team will go through the questions with you. If you don't have an email address on your record yet, but you do have one and you're willing to put it on your record, please contact us and we will add it on for you, and it will take us a couple of minutes, if that, and then you are free to use the system whenever you like.
That's great. And someone's asked, just to reiterate, you don't have to log on to this. You just need to verify yourself with your name, your date of birth, make sure your name's as it is on your medical record. So
you don't have to.
Go on, yeah.
You don't have to register for anything. You don't have to remember the app. You don't even really have to remember the website, because if you Google your practice, it's on the website link that comes up on Google, and you click on that and you click on appointments and it takes you to the Rapid Health link. So you don't have to remember anything.
That's a good question. Could
I just add? Can I just add in here just some lessons learned from some of our services that have already gone live? Because we're part of there's 8 practices in the modality partnership in Birmingham. If you try to click on, say, Handsworth Wood link, because that is currently live, it will go to our inbox, but you will be sent an automated communication that says the Black Country or Smethwick or wherever you registered, the link is not live until the 11th of November at 4:30. So please, my plea to you is don't fill up the other inboxes, because we won't be able to treat you through this system.
That's great. Thanks, Maxine. So wait till 4:30 on the 11th of November, and that's good. Good question. There's a couple of questions about, obviously, if you're doing on the phone, you're talking to a receptionist and giving them your symptoms and about yourself, and there's a concern about, it's personal to you and privacy and everything that. Can we provide some reassurance around that?
Sorry, can you repeat that?
If you're doing it over the phone with the receptionist and you're telling them everything about your medical symptoms, about the privacy and confidentiality around that.
Yes, so the questions that the reception team are asking you are to be able to facilitate the appointment at the end. As per NHS, your information is confidential within the healthcare team. Our reception team are part of that healthcare team. I hope that answers your question.
That's great, thank you.
Could I just add some provided reassurance on that? Everything that we take off you, the only place that information sits is in your current clinical medical record that we hold. It doesn't go anywhere else. It's not shared anywhere else.
That's great. That's important, Maxine. So what happens to the question? Like, it's basically saying, if you put something in and all the options that come underneath doesn't quite match what you want to, how should people manage that?
Yeah, so there is a general history option. So when you are on the first page and it says type in what problem you have, and we put in back pain, but there wasn't one that fit with what you were concerned about. So you had abdominal pain, but you weren't vomiting, or you weren't sure. On the options that you can select from on that menu, there is a general history one. That one will ask you a set of quite simple questions just to give that the GP who's reading those answers, because that will come into the inbox, a little bit of a heads up as to roughly, does this need a phone call today? Does this need a phone call in the next couple of days? Does this need just a face-to-face to get that information from you? So then they will send you a link from that once they've read it to book the appropriate appointment. So when the doctor then actually has the appointment with you, that information that you have completed in that template is saved onto your notes, so that they have access to those answers when they see you.
Excellent. We've only got about 6 minutes left, so I'm going to go for the really important things we haven't covered, and we try and give some succinct answers. Not so long, but let's try and rattle through some. So what happens if you're contacting us about multiple things? Should we do it all in one form? How should we do it?
Different forms, because the answers will be different for each issue that you have. So please fill in a different form for each problem. You might have a different outcome for each one.
You don't have to talk fast.
I will try and answer as many questions as possible. That's the GP in me.
Good, yeah. So again, can we just remind what we do if you're housebound or you need a home visit? How should you contact us?
Please contact your practice. Yeah. Call us. Relative coming in.
Somebody before what time in the morning is if we're a home visit?
Before 10 o'clock, ideally.
Possible, yeah. Okay. Can you choose which doctor when you get those appointments pop up?
Potentially. So depending on the condition that you have, depending on the urgency that you need to be seen, depending on if that clinician is working on the days that suit that urgency, you may well be able to have a choice of clinicians and you can see which one you can book with.
So there's a few questions about, okay, but if you can only phone, are you going to be like 50 in the queue and behind it? But was thinking that with everyone, as many people as possible can do it online themselves, then that frees up the phone lines. And we have seen that happen elsewhere. But we haven't talked about is nurse appointments, how we book smears, injections, wound dressings. Maxine, how do we do that?
Yeah, so that will still stay exactly the same. Please ring and the team will be able to help you. We will be introducing direct booking for some of those appointments, but we are not doing that until the new year. So carry on as you are, call.
Call and we will book that appointment for you. Patients, let's look. Oh, good question, Naz. Will the doctor read everything prior to having that consultation with you that you filled out in the form so you don't have to repeat again?
Yes, they should, but as a clinician, things may have changed from since when you filled in the form. So I would probably, in all honesty, I would probably go, okay, and so this is what I've got. Is that right? So we know that you have filled in the questionnaire. You may be seeing us 3 days down the line. It's good clinical practice to check that things haven't changed. So ideally, yes, but we know things can change.
There's a really good piece of information for locally, and someone's put on about Black Country Connected program. It's a program where you can get access to a laptop and internet connectivity to get access to learn digitally how to use things. So that's a really good. So Black Country Connected sounds like a really good thing if you're wanted to learn how to access the internet better.
I've taken a note of that so I can find out more about it as well.
I know, I've heard of that before. It sounds good. Can just reassure we can still use the usual online prescription ordering. We should still use that. Yeah. So that's Voice Connect, System Online, and NHS app. Yeah. Good. Excellent. And I put the link in the chat. Somebody asked that. So if we use the system at 10 p.m. at night, do we get an appointment the next day? It depends, doesn't it, Naz?
It does, potentially, yes. If it's something urgent, it should be seen within the next 24 hours. So you will be offered potentially an appointment for tomorrow. If there isn't an available appointment that's timely, it will come into the inbox for the duty doctor to manually review and triage and manage.
There was a quick question about what happens if your internet is down at home. Obviously, you can still phone us. Yep. If you're like me, that means my phone doesn't work either. So, but you can still
pop into the surgery. The team will be willing to help you.
And just some reassurance about will we get an appointment at our registered surgery? So if you are at Black Country, you will get a Black Country appointment. We're not going to ask you to go across the city to a different modality practice.
So the most important thing is that you use your website link. So please click on your own website link to access your service and your practice. And that's where you would get the availability of the appointments at your service, at your site.
Okay, and this there's coincided with a question before about how quickly will you get a response if you don't get offered an appointment online?
So the email that comes back says within 48 hours. We're really trying to do it that same day or within the next working day. So as soon as possible.
Last couple of questions. One about have we recruited sufficient extra staff to deal with all the requests we're going to get? Maxine?
So we have booked some locums for the first week to be able to support implementing the new system. So we will have plenty of appointments available, and across all our other services that has been ample, and we found it really, really helpful.
And because you've had that previous for the past few weeks, haven't you? You've done the same thing and it's worked well elsewhere.
Yeah.
So I think I pretty much tried to cover every single question. Thank you so much to everyone that's taken part and asked questions. It's been really useful for us, and I hope it's been really, really useful for you. So a few reminders now, just run through what's happening, when it's going live, how you get there, how you get to the form.
So online, it will be available on the 11th of November at 4:30 p.m. And then available across the practices from the next day. You can visit our websites for your practices, and you can click on the link to book an appointment, and the link is always there. At the site, there will be posters, there will be links, there will be QR codes so that you can access the link really, really easily as well.
That's brilliant. Well, thank you everyone for watching. And just if you joined us late, you can watch this again. It is recorded, and watch it at any time at your leisure. Thank you for so many for joining us and the questions. It's really appreciated. And we shall see you sometime soon. Thank you, everyone.
Thank you.
Bye.
Thanks. Bye.